was trying to push a button that didn't. All right. Can everybody hear me okay? Good? Way back? Got it? Okay, good. If you can't, let me know. I'm not a huge microphone person, but I'll keep this on. I just want to say thanks to everybody for coming today, Friday afternoon. I know it's super cold out. A lot of you probably have a lot going on, getting ready for your weekends, probably lots of schoolwork to do. So we appreciate you taking the time to come out here. Obviously, personal statements are a big deal. It's something that a lot of thought goes into, a lot of time goes into. So we're hoping to at least get you on a really good start today and get you feeling like when you leave here today, I know the direction I'm going to go. I have a good feeling about this now. I know what I need to do. So we're going to go ahead and get started. We'll do a couple quick introductions. For any of you that don't know me, my name is Jackie Johnston. I recognize some faces out here. I'm one of our pre-health advisors. Hello, come on in, have a seat.
And hello, my name is Rachel. I'm also a pre-health advisor. I just started in October, so I may have seen some people, nothing in person yet, but happy to see everyone in person here today.
And we do have another one of our colleagues, Amber Schneider, probably some of you know her as well too. So she's here to help us out and help with questions and things like that. So we're gonna get started. We've got a little bit of a PowerPoint to go through. We do have a sample that we'll go through too, just to kind of take a look and see what you think about it. And then we'll kind of go from there. But just a quick kind of question to start. Where is this not working? Where are all of you at in the process? Like how many of you have at least gotten a start on it? A few of you. Has anybody like not started at all yet? And if you haven't, that's totally fine. You're just like, I'm overwhelmed. I don't know what to do. Perfect. Glad you're here. Anybody like, I feel like I'm done with mine. Good. Okay. All right. So again, like I said, we really just kind of want to make sure you leave here feeling confident about getting started on it. We do have another workshop coming up in March and we'll plug it again later. I believe it's March 18th. And at that point, we'll ask you to bring the personal statement or where you're at with it, the draft, and then we'll do some kind of peer-to-peer review on it as well, too. So just to give a little bit of a background information in terms of like the personal statement, what purpose does that serve? It's really like your first interview. So when you're applying to all these different pre-health programs, they're going to look at your grades. They're going to look at your grades in the specific courses. If you've got really good grades, that's awesome. That's going to stand out to them. But then what else stands out that makes them say, all right, I want to bring this person in for an interview. So it really is kind of like a first interview. You want them to say, wow, this person sounds great. I think they would be a great PA, dentist, doctor, whatever it is you're applying for. And then from that point on, they would ask you to come in for the actual interview process. It should make the reader want to like actually meet you in person, get to know you a little bit better. It should definitely convey your personality. And we'll talk a little bit more about this too, but that's why you want to, like some people will take a copy of somebody else's personal statement and kind of use that format, but you really want it to sound like you. We want your personality to come through in this personal statement. And then obviously you want to demonstrate your motivation, maturity, understanding of the field in general. Like why do you want to go into this field? What has motivated you? What experiences have you had that have made you want to go this route? So just kind of a few of do's and don'ts in terms of writing your personal statement. So again, kind of create the picture. You want to create an invitation. Again, you want them to look at this and go, wow, I really want to meet this person in person. I want to get to know them a little bit better. Tell your story. And again, your story, not somebody else's story. You want it to your priorities, your judgment, again, that motivation, kind of why you want to go into the field. Couple don'ts, like don't write it like you would write an academic paper or a journal entry or like you're writing out your resume in narrative form. So some of the basics. So obviously start by answering any question that might be asked. Tell a story. Again, make it so that they want to know you. They want to hear more about your story. Be specific. Find an angle. So something that you think that you want to focus on and continue on and use that throughout the statement. Really concentrate on your opening paragraph because again, that's the first thing they're going to see, and that's going to be what tells them, do I want to continue on and read this, or I'm out. Like it hasn't caught my attention. I'm really probably not going to read this further on, or have this person be a consideration. So that opening paragraph really has to catch their eye. Tell what you know. Don't include some subjects. Avoid cliches. They hear that kind of stuff all the time. And again, don't focus heavily on someone other than yourself. So some examples we've seen students will talk about a family member or somebody else in that profession that really like motivated them or was their mentor. And that's great, but sometimes they focus too much on that person and on that individual. And it definitely needs to be, the focus needs to be on you. So while you can mention that person and maybe that's who you got inspired by, that's fine. But don't focus it so heavily on that person. You want it to be on yourself. Do you have a question? Mhm. Yes, and you can definitely still include that, but just don't make it solely about that person. Yeah, sorry. So if the question was, if it's somebody else that maybe just like wasn't a doctor or wasn't in that field, but still inspired you to go into that area, right? Yeah. Okay. And again, that's still fine to include that situation or include that person, and why and what the situation was and why it motivated you. But again, just make sure then the majority of the content focuses on you. So it's again, still fine to mention that individual, but don't focus too much attention on that person. So you also need to consider your audience, depending on which program you're applying to. You're going to probably have some health professionals in that field or associated with those programs. Some of it may be professors, researchers, but it may not be all individuals in that health professions area. The other thing too, I want to add with this too is, again, consider your audience. Think about how many people at each school are going to review your personal statement. So I'm just throwing numbers out there, and this might be a lot for some of you, but let's say you apply to 10 schools and there's 10 people on each committee looking at your personal statement. That's 100 people. So don't feel like you have to write a personal statement that every single one of that 100 individuals is going to love. You can't please everybody. So that's the way it is. That's how it's going to happen. So don't feel like this has to be perfect. I need all 100 of these people to love my personal statement and think that I'm this great person, because it's based on opinion. Not everybody's going to. So don't feel like you're going to that you can please every single person that's going to review that personal statement. So also things to think about, lessons learned, insights gained, demonstrate growth. Remember the so what? You don't have to simply have a resume of experiences. So you will have an opportunity in those applications to put your experiences in there. So they're going to see that already. So that's why the personal statement shouldn't be just all of those experiences, because basically then you're just duplicating what you've already put in that application, because they are going to see those experiences. So the structure of the personal statement, even though we don't want you to write it like you would write an essay for a class, it is still kind of going to be structured that way. So you're going to have an introduction, you're going to have a body, you're going to have a conclusion, and then you're going to have some transitions. So you still need to structure it. It needs to have, that same kind of structure, but again, not exactly the way you would write a paper for one of your classes or things like that. Good. Okay. I turn it over to Rachel.
Okay, so how are we feeling? That was a lot of content that we threw at you. What questions do you have? What do you want to dive more into? Or is everyone good to move forward? Where are we at? Questions, thoughts? We're open to the group discussion. If it's a big room, I feel that. But is everyone at a table with someone else or able to comfortably join another table if they're by themselves? Yes? So why don't you jump with a pair with your table and just kind of debrief all of this information. If you want us to go back to a slide, if you want to look at that again, we're happy to do that. Because the next part is we're going to start practicing some of that. So just this information, just kind of debrief what you're taking away, those main points, and what kind of your thought process is starting to do. Did you have a question? Do's and don'ts, yes. Right. So any other questions? Jump in that group, just a quick 2-minute discussion, what you took away so far, so we can build off of that as we begin to practice. Yes? So it depends on which health profession you're going into. It's anywhere from, was it 3,500 to 5,000 words? Oh, sorry. Characters, not words, with spaces. Concise. So just scroll slowly through this. Because this is MD. This is just text. Yeah. We ask apples. Yeah, but AmFast is deep. Amber's passing around a sign-in sheet as well. So before you leave, if you haven't signed a piece of paper, come see us up front, just so we can make sure that we get any follow-up materials that you may need after. How are we doing? Do we, by show of fingers, how many more minutes do we want to debrief? Or none? None? Okay, everyone looks good. All right, so we're gonna kind of do a survey of the room to see what pathway folks are on. So raise your hand if you are hoping to go MD, pre-med. Okay. DO. One in the back, I see. PT. PA. Optometry. Dentistry. 2, 3, 4. Pharmacy. Did I miss anything? OT. Awesome. I see you. All right. So we have a pretty good group. What we have pulled up. Yeah. Anybody we missed? Pre-vet. Oh gosh. Pre-vet. So sorry. Okay. So this is from 2021. So this may not accurately represent this cycle that's currently starting, but this will give you a good idea about what the prompts may be for your personal statement as you go to apply. So I know it's kind of small, so feel free to, oh goodness, look at the screen at your little table. So this is for MD. It's at 5,300 characters. So MD is 5,300. DO, 5,300. And we'll come back to this also as we continue going. Then PT is 4,500. OT, no character limit. We looked in, it's more like 5,000. An important piece to remember is that they have to read hundreds of applications. So you want to make sure you're being concise so that yours isn't kind of just forgotten or they don't read the whole thing. So if there is no limit, 5,000 characters is a good place to sit. Optometry, 4,500. CASPA PA, 5,000. 4,500 for dental. Pharmacy, 4,500. Vet, 3,000. Okay. All right. Did we get everyone? Dietetics. Yep. All right. So let's get back to the PowerPoint here. So as you're thinking about, we're going to go into more practicing prompts. So that's coming soon. So styles for personal statements. So I'm going to read the first sentence. When I received my first microscope set at the age of 8, I couldn't wait to swab the inside of my cheek and smear my cells on a slide. Do you see that picture that was created by that sentence? And you're kind of drawn in, wondering where that's going to go. That's one of the styles that you could have for your personal statement, that storytelling aspect. You want to grasp the reader's attention so that they continue reading more about what you have to say. The same can be said by painting the picture. I remember thinking about the long, cold nights that Edwin Hubble spent staring into the telescope at Mount Wilson Observatory. Setting the stage, drawing people in, that is what you're trying to do in these personal statements. Again, we'll say it multiple times, but it's not an academic paper. You are introducing yourself. So this is you telling your story about why you're pursuing this pre-health pathway. Okay, so a couple of different structural things. You do not have to use this. This is just an example of how to create structure. Has anyone heard of the Peel method paragraph structure before? No? So it starts by making a point. Then you provide evidence to back up that point. And you explain how that evidence supports your point, and you link it to your next point in your next paragraph. So pretty simple, but if that helps you kind of develop as you go on, and then you can refine as you go. Does that make sense? Cool. Another method would be the STAR method. So very similar situation, describe vividly the environment, what's going on, what the task was. The task and obstacle, so describe what was expected or asked of you in terms of responsibilities, or what challenges that you had to overcome. Action, detail the specific action steps that took you to handle the tasks or the obstacle. And then what was the result? Are these helpful in terms of providing structure? Yeah. So
all the way to 3 and then to 4. So what happened? So these were the action steps. Then I ate. And you are not giving your reader about who, telling them about something that how you react to, how you respond to adversity, how you those the best part. That's where all the details.
Thanks, Amber. Okay, so in the process of writing your personal statement, expect to have many drafts. Start out today. We're going to start out as messy or as clean as whatever your personal fit is. And then we're going to refine until you actually go to submit. Think about who you want to have review that. Is that a professor? Is that a peer? Is that the writing center? Who's going to be reviewing your personal statement to help you refine it? If you're stuck, put it away for a couple days. Let it sit, let it simmer, and then come back and then redo the whole process all over again. Start another draft, refine the draft, review again. It's a process that we recommend starting as soon as possible because you can always continue to make edits. Yes? Yeah, so to repeat the question, are there specific people in the Writing Center to review personal statements? Do we know?
You're going to want to go to them for mechanicals. But big picture, that's not because it's your peers, right? But they are excellent in grammar, punctuation, transition. So I often go to them a little bit later in the process when you're kind of fine tuning things. But big picture, probably more advisors, colleagues, professors, that kind of thing.
Any other questions? That was a good one. Thank you. All right. So questions to consider. So at this point, if you don't have something to write or type with, I would grab that out because we're going to start practicing starting your personal statement. So here's some questions to consider up there on the screen. Who are the most influential people in your life and what did they do for you? And this does not have to be concise. Write down whatever comes to mind to get started because again, you can always pick pieces out later. Just write down whatever comes into your mind. What have been the pivotal moments in your life? Do you feel a passion for medicine or your pathway specifically? And what is the source of that passion? So start thinking about those. If you don't have it right, you just need to brainstorm for a minute. We have the time. It's been about 5 minutes. How are we feeling? A show of hand, thumbs. Good, bad, good. Did everybody get something down? Yeah? Okay, so keep these questions kind of brainstorming in your mind. We're going to show you a couple of examples of personal statements and then go over how it was received. Some feedback pieces, hear feedback from you all to kind of get the ball rolling. It is important, we'll mention again, not to necessarily copy this strategy exactly because you want your personal statement to be unique to you. It's telling your story. So these are just examples to kind of get the ball rolling, give you some structure examples. Okay? So I'm going to pass over to Amber.
So these are both med school examples. So kindly, some of the med schools came together and put together some personal statements, and then 4 different admissions officers from 4 different institutions gave feedback. So it is very med specific, but I think it is very applicable across the board. So that's why we still use the example. So what I'm going to do is I'm going to try and keep it pretty big. Can you all see this pretty well on the small screens? Yep. Okay. So I'm going to scroll down so you can get a good part of it. Then I'll move it up to let you do the last paragraph. As you're reading through though, jot down some notes on your thoughts so that we can then kind of talk through it afterwards and see what you think. Okay, is everybody good? We'll give another 30 seconds, I think. All righty. So I'm going to jot down your guys' thoughts as you tell me what you think. So, thoughts, what do you think? Here? Don't type when people are watching. So listed a lot of things, experiences already prevalent throughout the application. In the experiences section, focus on a specific experience. Give us a story. 100% agree. Yep. So it was very much, first I did this and then I did this. It was very much reading that resume. Nothing caught their attention. Great. What else? Yep. So hard to make a connection with the writer, no sense of personality. I think I saw another hand maybe. Yep. Hmm? Yep. Any other comments? So tell me one thing, not something that they did, about who they are. What can you tell me about who this person is? If they show up in an interview tomorrow in person, who are you going to see in front of you? Maybe Hispanic, or at least some Spanish speaking skills. Really didn't give us more information on that. They said it was a second language for them. You're struggling to answer this question because we have no clue who this person is, right? They just did this and then this, but there's no sense of who the individual is, who the person is that did all of these things. You guys are hitting it 100% on the head. So here are some of the kind of summarized version of the feedback from the admissions officers. This person is service oriented, speaks with warmth and compassion, suspect he has an understanding of what it would be like to be in healthcare. He would probably be effective, sensitive physician. So there's some very non-concrete words there. Maybe, probably. This reader is not walking away with conviction of who this person is. That's not what you want to accomplish. Next reviewer, not a very strong applicant. Limited experiences, minimal leadership, experienced stressful situations. Okay, did they fail Orgo and what did they do about it, right? We're not going to put in your personal statement that you failed Orgo, but did you have a challenge that you overcame on your path to medicine? How did you respond to that? Perseverance, those are great things to showcase. Not a risk taker, strong intention to please perhaps. How would he seek help if he was in trouble? Doesn't develop the Spanish information fully. Not a revealing essay, not adept at conveying insights about himself. Third reviewer, written reasonably well, lacks any personality, likes the desire to be in medicine since middle school and helping Spanish speaking population, but it isn't supported by the experiences that the person chose to engage in. Doesn't include details of experiences, not personalized, little insight into what makes him tick, more of a check all the boxes on the list. I volunteered enough hours, I did this for enough hours, but there's nothing, you didn't gain anything from those experiences. This is my favorite. So this is the fourth reviewer. So if we go back to the first sentence, since elementary school, medicine has appealed to me as a humanistic profession. What elementary student knows what humanistic means? Right? So be careful about what it is you're actually writing. That they were trying to say they wanted to be, right, since a physician since elementary school, but they're not conveying it fully. So make sure when you take a step back, that's why we say, you know, put it down for a week, come back to it. Make sure you're actually paying attention to what it is you've written. So overall, not real great feedback, right? So we show this to highlight what you want to do. You want to take it to those next two steps. Give me the example. Show me what you did in a stressful situation. Show me how you interacted with a patient or volunteered with a student. Give me the exact example. I want that visual of putting the cells on the slide, right, for the microscope. All right.
That's one of my favorite. That kind of stuff. So there was like a couple of there was like a pen in like the middle of it. So that's where the writing center.
Absolutely. Okay, so we're going to do a second one of these. This is Terry. So we'll go ahead and start on the first three, and then I'll scroll down for the last one. All right. Everybody good? Okay. So what are your thoughts on this one? Yes. So very repetitive. Had they been much more concise, they could have put in a lot more detail. Yep. Good. That is almost verbatim what one of the reviewers said. So there's no attention grabbing. Had they started out by saying they grew up in a small rural town, that would have given us a sense of place. But as it is, several factors have contributed to my decision to become a physician. So what? Like what you just gave away those characters and you have told me absolutely nothing. Right? Right? Mm-hmm. So the flow is a problem. So too many different topics in one paragraph. Absolutely. You're getting lost in here. I don't know what the takeaway was from some of these. Absolutely. Yep. That's right. Mm-hmm. Mm-hmm. So no passion came through until the very end. Bring relevant experiences forward. 3. Others? All right, let's see what the reviewers had to say. First reviewer gives little evidence of activities to support their interest or concern for others, talks about activities but does not talk about the people they encountered, says they're people oriented but doesn't come through, doesn't talk about deriving personal satisfaction from participating and assisting them. So this comes back to, don't tell me something, show me something. You want to tell me you're service oriented? Explain to me the experience that you had when you were volunteering at a soup kitchen. What was that like? Who did you encounter? Paint that picture for me. From that, I will derive that you are service oriented. But don't just tell me you're service oriented and don't give me anything to back it up. Right? Second reviewer, not revealing little depth or insight regarding the personal experiences. Interest in rural medicine appears genuine. So if this was a rural serving institution, that might be a plus. Third, lacks detail or reflect experiences, reads mechanical. Give us some examples. What did you gain from those sports? Including the orgo grade is okay, but I need some more information. Like what happened? Why didn't it go well? And what are you going to do differently? Pharmacy tech and EMT descriptions are lackluster. They lack details. I want more, or I'm interested in gaining more insight into Terry. I want to know them better. This didn't get me there. Fourth reviewer, generic beginning, repetition of discipline, suggests inattentive writing, limited vocabulary. Paragraphs 3 and 4, which were the science ones, could be deleted because it's covered in the experiences or in their transcript. It's a very empty statement. Overall superficial. Our school values leadership, initiative, creativity. This essay is below average. So a couple of things I want to kind of highlight. So I mentioned the show me, don't tell me. This ending, I want to point out here, where they're talking about they want to basically be a physician in their hometown rural area. That whether or not that should be included, I think depends on 2 things. What schools are you applying to? CMU, they're focused on rural med. MSU, underserved populations. Oakland, not so much, right? So you need to make sure that you are applying to schools that match what you're writing. If you're not applying to schools that are supporting this, then that line doesn't fit. Also, are you going to apply to any out-of-state schools? Most of the time, out-of-state schools are looking to retain their students in their state. They want to train healthcare providers for their population, not for you to go back home to your rural community. So it could be okay in there depending on where they're applying. And then some of that negativity about they introduced that negativity of the orgo grade. You have to be real careful about that, right? So if you're going to introduce some negativity, make sure it ends on a positive note. And then pull it back up. Yep. Good. Right. So the question is, should we be writing one personal statement or multiple? A little bit of both. So for your primary application, the one that you submit to CASPA, ADSAS, AMCAS, ACOMAS, all of those things, it is one essay that every school gets identically. So it has to be broad enough that it applies to all the schools you've chosen to apply to. Now, if you have chosen only to apply to schools that are rural serving institutions, then great, that fits. But if you have chosen to apply to a wide variety of institutions, they're not all focused on that, then this is a red flag and shouldn't be in there. So then part two though, so that's the primary application. Most institutions then send you a secondary application with additional essays. Those secondary essays should be specific to the institution. So you should not, and I think we talk about this in a minute, but you should not be reusing secondary application essays for multiple institutions because you should be writing it to that school's mission and program. Other thoughts or questions? All righty, I'm going to hand it back over to Rachel.
All right. So back to those notes that you originally took when you were considering these questions before we jumped over to the example. Getting back into that headspace, we're going to get started on brainstorming your personal statement. So start making a list of extracurricular experiences, class experiences, volunteering, clinical settings. Make a list of all of those different things. Just bullet point, list them all down. Research, hobbies, things that show who you are. Significant things to your life and your experience that you'd be willing to share. So again, just making a list, those things that highlight your identity, things that you have experienced, important to you, that you'd be willing to share. Just a list. Another minute or so. When you feel like you have a good list started, just look up here, give me a little eye contact. All right. So now that you've created that list, start reviewing it and pick one that you think exemplifies who you are as a person. Huge personal trait, but also can then be related to how you would be in the healthcare field, like how you would be a practitioner in healthcare. Once you have that selection, just pick one for now. Start writing about that experience. Anything that comes to mind doesn't have to make sense or have good structure. Just write down all the thoughts that are associated with that one defining experience, that one personal trait that you want to talk about that can exemplify to these admission folks why you would be a good healthcare practitioner. Connect it back. Just start writing all about it, all the details that come to mind, the notes, bullet points, whatever style works best for you. Just get all your thoughts out on paper. So I know that we have been writing a lot. By show of hands, does anyone feel more productive or it's a better method to kind of talk this out with someone at their table? Anyone by that? Yes or no? A couple of folks? So I'll give just a couple more minutes if you want to share with the person next to you kind of about your thought process, writing that down. And then we're going to talk about next how you reflect on that. So as you're explaining this to the person and talking out those thoughts, reflect about what the critiques may be, because I know this was the rough draft. So use this as a framework to kind of refine what you just wrote down and all of those thoughts and turn it into a concise part of your personal statement. We're not walking out of here with that today. Maybe you are, maybe you're not, but that's okay. Use this as a framework, the slide that we have up, for questions to consider about what you have written down and how you can refine that into your personal statement. Feel free to speak aloud. Is anyone willing to share an example with a larger group? Do we have a volunteer? All right, I'm coming with the microphone.
One of the things I put down for the list was I volunteer my time to help some of my fraternity brothers with homeworks if they need help. And with this experience, it shows that I am willing to take time out of my day to help someone with a class that I have never taken before because they are a whole different major or a class I've never even heard of. This shows that I'm not scared of a challenge. I feel like it shows that I'm able to jump into something brand new that I've never even worked with. I also feel like how I'm able to keep calm and be able to use words to explain something to someone who doesn't get how it's written out. The amount of times that I've had to explain a homework assignment to one of these brothers because they don't understand what it says, I think is very well because as doctors, we're going to have to be able to explain to patients what we're trying to say in a sense, like dumb it down for them. Not trying to be rude, of course, but in an easier way to say something. Um, I'm also showing the level of patience that I have. The amount of times that things I see them doing that comes natural to me that I think are easy, I can't think that same way for everybody. It's not easy for everybody. Not everybody can do calculus in their head. Not everybody can do physics like it's nothing. So with this, it's helped me be patient with everybody around me and be able to take time out of my day and not try to rush things and not get mad at people just because they can't understand it the way some of us can. I also am able to see how others actually see things through their eyes, per se. My point of view, I can see 2 + 2 will always equal 4 in my head. It's not hard. But for somebody else, 2 + 2 might not equal 4 in their head for some reason. They see it in a whole different aspect of it. So for me, it's showed me how a lot of people think differently than the rest of us do.
Thank you so much for sharing. So I know this is still the rough cut of everything, but by show of hands, do you think that that example showed, what was your name? Luke, what Luke wanted to portray? Raise your hand if it showed what he was trying to portray. Why or why not? Those who raise your hand.
So I think that while you made a lot of good points, I think that some of it was kind of overshadowed or drowned out by other things being said. Like you explained a lot why you would have to be patient with somebody, which is an important quality, but also like I think you could be more concise about that and then I guess talk more about like your own I don't want to say like struggles with it per se, because like I don't want like that negativity and all that, but like I liked how you said like you weren't scared of a challenge and that like you're actively like being patient and things like that. And I guess just drawing more upon like how you do that, if that makes sense, instead of like why it would be necessary. I think that would be helpful.
More personal example. Awesome. Anyone else have anything? All right. Thank you again, Luke, for sharing with us. All right. If I kind of show the group, do you want to keep chatting or move on to another bullet that you wrote down and do the same process over again? So write more about a different point, a different experience. We'll do that. Saying nothing. So let's do another one. Same process. Think about that list that you wrote if you have something else you thought of, and then write about it. Think about how that will show that you'll be a good healthcare provider. All right, go ahead and finish your thought. We're getting close to the end of time here, so I don't want to cut off the creative process, but I do want to leave some time if anyone has any questions at the end. So at this point, everyone in the room has started 2 experiences that they're going to include potentially in their personal statement. Got the ideas flowing, got lots of different ideas to choose from as you continue to build out your personal statement in the future. Word of caution, we always recommend not waiting till the application to start your personal statement. You don't want to save this to the end. You want to make sure that you're putting your best foot forward, because this may be the foot that gets you into the interview. Again, the personal statement is your first interview, air quote. It's what's going to intrigue that committee to bring you in for that interview for the actual place in the program. The other word of caution is if you have a friend or a family member or someone who's written a personal statement before, we do not recommend you follow that as a guide, because you may lose your voice. You want what your personal statement is showing and represented to also show up on the interview day when you're there in person. So if you use someone else's flow, structure, etc., it's not necessarily going to portray everything who you are. So we can definitely look at examples to help us in the thought process, but you shouldn't be using someone else's personal statement as an outline. The other piece, there's a reason we didn't start with the opening paragraph today. Sometimes that's the hardest thing to write, and maybe the last thing you put together. Just get started somewhere. You can always add that in last. Oftentimes it is last, because that's the first impact that you're going to make. So I know writing papers, a lot of times the first paragraph is always the hardest, because I was just like, how do I start this? How do I start this? How do I start this? It's exactly how you did it today. Think about that experience. Think about that personal trait that you want to put forward in your personal statement, and then just build off of that. And you can always refine and refine as you continue getting closer and closer to submitting it for your application. Did you have something? Just a little pop. All right. Again, just to mention, Amber had already mentioned this a little bit before, that secondary application, once you have to resubmit again, make sure that you're looking at the mission of that institution, that program, who they're serving, what population they're representing, where you want it to be, and making sure that you are making your personal statement specific to those things. Each one for your secondary application should be a fresh, new personal statement that's specific to that institution or program. We have a couple of resources here, and again, we're going to send these out. There's a workshop at the University of Minnesota that you can register for if you wanted additional help and guidance. It's a self-paced one. Yep. And then this dental and pharmacy YouTube video kind of walks you through that process. It's very much like a presentation like this, recorded. It's about 58 minutes long. So if you are going to utilize that YouTube, make sure that you have that time spread out, or remember where you're at when you pause. All right, so we covered a lot of information. We brainstormed today. What questions are still lingering out there that folks have? Yeah.
So the question is about putting specific medical details or describing a procedure or something like that. She was advised to leave that out of a personal statement. So I'm going to expand it just a little beyond your specific question, but be sure that whatever you're putting in there is accurate. So that's a good point. 2, make sure, and we did have a slide on this, but make sure you're remembering who you're talking to. Most of the time on that committee are practicing professionals in the field you're trying to get into. So if you speak negatively, like I read a statement before where a student would say something like, dentistry is not inclusive enough, and I don't think dentists are doing enough to connect with patients where they're at. You just told a bunch of dentists that you don't think they're doing a good job. careful about that, right? You can, so you phrased it in the negative, flip it and phrase it to the positive. I'm excited about these things that I'm passionate about, and I want to enhance or bring more of that to the profession and build upon the foundation that's already there, right? So who is your audience? They are practicing professionals oftentimes. And there was a third piece to that that I have forgotten. I'll think of it and come back to that. That was a good question. Oh, the specialty. That was the third thing. So sometimes students think they have to know what specialty that they want to go into and put that in the personal statement. I know I want to work in orthodontics. I know that I want to work in pediatrics. No. The job of your undergrad is to make sure that you know you want to go to PA school. You want to go to dental school. It is the job of PA, med school, dental school for you to figure out your specialty. So don't worry about having that figured out. That's what they're supposed to do. So that specialization shouldn't typically be part of your personal statement. There was another question, I think. Yep. Mhm. So on the list of don'ts, the cliches, so I've always wanted to be a doctor. Well, so has everybody else, right? It's the most common thing it's just a cliche. You've always wanted to be a doctor since you were 7. It's so redundant and basic. You have brought nothing to the table. This one, I'm going to say it, but I'm going to say it with an asterisk. Okay, so note that asterisk. I'm going into medicine because this family member had this illness and that made me want to be a doctor. 90% of students going into a form of healthcare are going in for that same reason. Okay, so if that's going to be in your personal statement, it needs to have a good foundation. It has to have a good connection to the present. So if it was when you were 7, again, it might get a one-liner in the personal statement, but it can't be a 15-line paragraph going into their experience because that's not your experience. So that's almost also a little bit cliche. Again, I know it's a very big impact. It's what often piques a student's interest in medicine, but it's not necessarily about what piqued your interest in medicine or healthcare. It's about all the experiences you've had over the last 3 or 4 years that have constantly been reinforcing. We want you to focus more on those things. Something got you here, but now that you know so much more, why do you love this field? So the question is about using a quote or starting with a quote. Sometimes you read it's a good idea, sometimes you read it's a bad idea. So remember those 100 people we were trying to please earlier? 10 schools, 10 committee members, 100 people. They're all going to have a different opinion. If you're going to choose to do it, it has to make sense, has to be concise. Like you don't want to give, 5 lines up to it. And it has to really flow into your paper, right? So I've seen students do it well and I've seen students do it poorly. It just depends on how you do it. Other questions? We are giving you all 5 minutes back to your day. We are going to, as Jackie said earlier, we are going to have personal statement part 2 in a month. And that's where we want you to bring some form of a draft. And what we will do is we will pair you with two students who are not in your pre-health pathway, because we don't want you to get in your head about somebody else's personal statement in your pathway. So we'll pair you with somebody and you'll bring 3 copies. The first copy, we're going to start out with a personal review. We'll give you some techniques and tips on that first step. And then you'll peer review 2 people's. So you will see us sending an email out to confirm who's all coming so that we can try matching people in advance. Reach out to your advisors. We are here to help you with questions as you're going through this process, and have a great weekend.